Dr. Hassan, your time start now, please.
Mm. Hello,
Hello.
my name is Dr. Bakr. I am a doctor in the heart clinic. Am I talking to Mr. Peter first?
Yes, Doctor. Mr. Peter Harris is speaking.
And you are 55 years old.
Yes, you are correct.
Okay, nice to meet you, Mr. Peter.
Nice to meet you, Doctor. Thank you for coming.
Okay. Mr. Peter, we're here to discuss some issue about your health. Is that okay for you?
Yes, Doctor. You can.
Okay, before we are starting this discussion, do you want anyone to join you?
No, Doctor, you can discuss with me. I have situation team when I can call my wife. No problem.
Okay. And how are you today? How are you feeling?
I'm feeling much more better in compared to the time I admit in your hospital. Much more better, Doctor.
Okay. And can you tell me why you are admitted to hospital, Mr. Peter?
Um, 2 days ago I admitted in your hospital with some chest pain and I have also high body temperatures and also loss of appetite is there. So I, with this complaint, I admitted in your hospitals and yeah,
Do you have any idea what could be the
mm,
cause of this? Or
doctor,
someone?
talking something. There's some infection in my heart. I actually did not get the proper idea, but they did started the medication, and I'm completely feeling fine. And now I'm planning to go home, doctor.
Okay, Mr. Peter, do you have any idea about what is going on? Or do you want me to
I
explain
just
to you?
know there is some infection in my body, but they did not explain actually what's going on. So the good part is I'm completely feeling fine and I can go home.
Okay, Mr. Peter, we will discuss this later. So, just I want to discuss for you what is going on. Is,
Okay.
is that
Yeah, you can.
okay?
Yes.
Okay, then I will draw the heart.
Mm-hmm.
Okay. Mr. Peter, yes, you have a condition which is called infective endocarditis. Don't bother
So,
about this name. I will explain everything.
it's a
Infective,
simple infection like the lung, right?
no, this is a very serious infection, Mr. Peters. The infective endocarditis is usually caused by some bug,
Mm-hmm.
and usually the cause of it, usually there is a source of infection. Sometimes it can be like injection in blood channels,
Mm-hmm.
some wounds, okay, and
But in
sometimes
my case, I suppose in my case everything is going fine as the drug is responding. I'm feeling completely fine, doctor. My appetite also come back and my fever also subsided. So I'm feeling pretty fine, doctor.
okay, just I want to discuss the bad effect of this disease if it's not treated well. Usually,
Mm-hmm.
there is a usually it's need a prolonged treatment of uh, antibug. Usually, it's about at least 6 weeks.
Oh my God. You were telling I have to stay in the hospital 6 weeks just this for this infection, doctor.
Yes,
It
you
does
need.
not make sense to me, doctor. I completely feeling fine, and I can take the rest of the medication in the home. There is no
Okay,
point to keep me in the hospital for 6 weeks.
why you want to go home?
The reason is I'm feeling fine. Okay, compared to the time of admission. The first reason. Second reason, I don't think it's really necessary to stay in the hospital for 6 weeks. Oh my God. And I have a lot of work in the home.
Okay, Mr. Peter, yes, I appreciate your concern. Okay, but just I want to explain you if you are not treated well from these infections, what will happen? Okay,
So what will
I will.
happen, doctor? I think it's a simple infection, and probably I can continue the medications in the home. So I'm pretty sure that there is nothing will happen, doctor.
Okay, Mr. Peter, this is not a simple infection. Usually, the infection in the one of the gate of the heart. I will draw. I will
Mm-hmm.
show him here. Okay,
Okay.
and this is usually there is a little blood coming to this area. Okay,
Okay.
so it's
Mm-hmm.
a combination of antibiotics, and it need to be for a long time and through the IV channels.
But I mean, doctor started the medication and I'm feeling fine, doctor. I mean, can I just reply me? I mean, why I have to stay in the hospital for 6 weeks when I can continue the medications in the home or at a nearby center?
Okay, we want to give you this medication through our IV channels.
Mm,
Okay, and this medication, some of it is need to be monitored,
mm.
the blood to be monitored, and if you go to your home and you develop any problem, we are expecting maybe there is some bad effect from this, like your heart become not pumping well,
Mm-hmm.
and maybe there is some trouble from this infection to your brain, to your tummy.
Oh my
We
God.
can.
I mean, is it possible to continue the medication in the home? Okay, if I don't want to stay in the hospital.
Okay, for this I will talk to the bug doctor, which we call him infectious disease doctors.
Mm-hmm.
But for the first 2 weeks at least, to give this through the blood channels.
Okay. But doctor, I have a lot of works and I'm the only breadwinner for my family. So my wife and I mean, little kid is there. So, I mean, no one to take care of them. So I'm the only person. And
Okay, do you
without
have
me,
any?
they cannot, I mean, survive, doctor. I'm the only breadwinner for my family.
Okay, Mr. Peter, yes, I can involve the social worker in this. Who will solve this problem for your kids and all?
But I think, I mean, without me, they would not get the proper support, doctor.
Social worker will provide everything for your kids. And do you have any family members neighboring to you
Any
who can
family
help?
members? Sorry.
Yes, any one of the family.
No, I mean, no one actually. We are living in the city, so no one is nearby of us. So we're just living alone, doctor. So may I
Okay,
know? What will happen if I go home? Because he was just trying to, pursue and mean test in the hospital. I'm not clear. Okay, as you said, the infection is really dangerous, but I'm feeling pretty fine. Why I'm feeling fine? And if so, the infection is dangerous. So what may happen?
okay. As I told you, Mr. Peters, yes, you can feel fine even after 3 to 4 days of this antibiotic. Okay, but
Few minutes left.
to treat to treat all the bug, and because this is a very serious areas. Okay, it can lead to leakage of this
Hmm.
valve. It can lead to rupture of this valve, as I told you, and can lead even to spread of this infection to other parts of. So we are observing this. So why we are
Yeah,
keeping you in the hospitals? And this bug, usually, as I told you, it is an area which is less blood supply. So it need a
yeah.
prolonged
But
antibiotics.
but doctor, I mean, just try to consider my situation. I mean, staying in a one room for 6 weeks is really like a prison. There is no support of any entertainment, no entertainment tools or TV, something like that. I love to watch cricket match, and the upcoming matches I'm going to miss. So that's why I want to live. So can you, I mean, arrange something in the hospital? I can at least, I mean, sometimes spend my time in front of the TV or something like that.
Okay, I will talk to the managers, the nursing
Mm-hmm.
manager in the department, which you can, if there is any available room, comfortable room, you will be shifted to that.
Mm-hmm. Okay,
Okay, and
that's
what?
really appreciated. Okay.
Okay, do you smoke, Mr. Beat?
I used to smoke, yeah, but I'm
For how
taking
long?
one and a half manner. I mean, for last 20 years.
Mr. Peter, smoking is not good for the health. So I advise you to stop smoking. And if you willing, I will refer you to the smoking cessation clinic. Do you drink
But
alcohol?
mm, I'm socially after lunch in a half glass of wine, doctor.
Mm. And how this is affect your job
I mean, it's
and
affecting
daily
a lot,
activity?
doctor. I mean, particularly staying in the hospital for 6 weeks. When you said, I mean, it came to me as a shock. I mean, as you know, I'm a breeder, and I just, I mean, earn and just we feed our family hand to mouth. So it's really tough for me to stay in the hospital.
Okay, Mr. Peter, yes, I will talk to the bug doctors. Okay. If there is any
Time up,
chance after.
complete time up. Fine. So, Dr. Hassan, how does it goes?
It is a challenging, but I do my best.
Challenging in what way?
Hmm?
Challenging in which way? And what way?
Okay, I am not sure about if he can go home after 2 weeks, something like this, and to receive the.
I mean, anything you could have done differently according to the task and scenario.
Okay, just I want to convince him to stay in the hospitals.
Yeah. If the patient doesn't want any other step you want to follow,
First, I was asking why he told me. Then, if he's not convincing, I will involve my seniors to talk with him.
consultant, your consultant. Yeah. Okay, fine. We'll discuss the case. I'm pretty sure this is a very well-known, very common case, but we'll just recall and retouch the point. Usually, sometimes we miss in this type of scenario. Before going to the feedback part, I would like to interact with the other candidate. Okay, anything you want to add extra along with the Dr. Hassan's comment or anything Dr. Hassan did not address in a way he should in a
Yes,
way
a
or deeper way? Mm-hmm.
risk factor for Atsab if he's as if he sharing needle, something like this.
As guys, Dr. Hassan, I will share that, but I'm just trying to interact
Uh,
with the other candidate. Okay, so if anyone has any important point, this is how we can make the session interactive. If
Complications of infective endocarditis, sir.
sorry, I didn't get to. Can you repeat it again, please?
Complications of
Complication,
infective.
yes,
Yeah.
complication. He could dig dive into the complication, and
Hmm.
this is the reverse psychology. We will use this type of scenario. Fine, doctor. Complication and other things. I mean, as a safety netting or as a precaution to find out the source of infection, because communication is not just, I mean, talking the things what is written in the scenario. As a doctor, we have to give some extra layer of information. Okay, it doesn't require knowledge, but it shows that we are, as a safe doctor, we are exploring, okay, what happened before, okay, a little bit, and what might happen when they will be discharged. And as a safe doctor, we have to give some safety netting when they're planning to discharge. We have to check their idea. Okay, do they have the proper idea and an adequate idea of the impending complication? In this case, there are lots of complication might happen. Dr. Hassan, just give me some idea, infection, some vegetation, stroke might happen. But I mean, the tone we should use, I mean, bring some severity and I mean, intensity when patient will be panic. In such situation, it's worthwhile. What I mean by that, your tone as a doctor, when you will put some extra stress on some particular complication, and at once the patient will change their mind and they will say, "Oh my God, I did not thought in that way that this kind of, I mean, grievous complication might happen." And this is how you can reverse the scenario and reverse their, I mean, plan and do everything against, okay, what they are facing as a problem. For example, in this case, patient has lots of problem. Sometimes patient will express in the form of really problem, or sometimes they will just feel hesitant. For example, sometimes they're saying, I'm the only bread earner. So as a doctor, we have to pick the cues because it means there is no one to support their family member. he's the bread earner, so we have to arrange the bread, livelihood for their families. Okay, so social workers, Dr. Hassan did that part completely fine. Sometimes in a scenario while DAMA or patient is refusing to stay in the hospital, there is some hidden cause not to stay in the hospital. We have to explore that. Okay, if they don't want to say that, we have to dig deeper. Okay, Mr. Peter, okay, or Harris, may I know, if you don't mind, feel free to share with me. Did you notice any rough things or rough behavior or any interaction that did not went well, or are you facing any problem or any inconvenience to stay in the hospital? If you just give the extra space, every option, they will gradually, uncover everything. Probably they will say, doctor, the food is not tasty. I'm a smoker. I'm not getting the opportunity to smoke some. Okay. And there's some, football match or some birthday parties there. I cannot, see or watch and attend. So these are the hidden things and agenda that's actually pushing them to leave the hospital. But if you can meet them, they will make an agreement. Okay, doctor, I can stay in the hospital, as you are saying. Okay, so your language will completely change their way of thinking and plan. In this case, Dr. Hassan, starting was fine. You said in a typical way how you want to be addressed and why we have been gathered here. So we have been gathered here to discuss about health condition and treatment plan. Is that all right? Okay, do you want to be present in this meeting? That's typical starting. That's fine. And I was particularly happy with the Dr. Hassan approach when he said, okay, do you have any idea what brings in the hospitals? So it's a pre-check. Pre-check is very important. Although from the scenario, you might think that patient already know that patient has some problem, chest pain, weight loss. Why I should check? No. Sometimes surrogate in the real exam, they will forget everything as they are doing surrogacy. Okay, so sometimes they forget or bend something. So you have to recheck and recall. Okay, they are getting in the same place. Okay, so far you can say, okay, from the case that I came to know that you have some issues. Can you tell me what brings you here and from the day one, and what you have been updated so far? It means you're getting the patient's point. At the same time, you want to take the patients with your flow. Let me draw a picture or dot. For examples, the whole context of the scenario like this. Okay, patient already knows up to this point. Okay, he came with the chest pain, shortness of the breath, fever, and now you have to inform the report from this point. You have to, carry on the conversation. Somehow, patient is not completely aware about this part, and you are assuming from the scenario, patient is already well informed. So when you will just move forward, every time patient will disturb you, surrogate will disturb you, doctor, I'm not getting you, and you have to again back to that point, clarify the initial symptoms, and you have to take the patients once again with your flow. So it's not a smooth conversation. So it is better to spend 30 seconds. It is better to spend 30 seconds, give the baseline, and now express the, or just give the description of the test results, what has been done so far. And then say, okay, what's our plan? In this case, the starting could be like this, okay, what have been updated so far? Can you tell me more about that so that we can be in safe base? If they said, doctor, I admitted in your hospital 2 days ago, have chest pain and shortness of the breath and weight loss. Now your doctor did some investigation. I don't know. It means there's some investigation was done and they don't know, although they know they have to stay in the hospital, but they don't know about what exactly happened. So there's some clumsiness is there. So you have to clarify. And by the way, by asking these questions, surrogate also check your complete overview of the scenario. Okay, so always note something when you are, making the note. Completely, picture the scenario, what happened from the point by point. Patient came to us with the shortness of the breath, chest pain, weight loss. And based on that, our suspicion, we did a investigation called blood culture. And we also did a jelly scan, okay? And both tests confirming that you have an infection in the inner layer of the heart. Okay, did anyone say that? No, doctor, or yes? Based on their knowledge, you have to acknowledge and you have to, speed up your scenario, right? Okay, let me explain. This is your heart. Then you can draw. This is the heart, and some infection actually happened in the inner lobe of the heart. And by the way, which is completely treatable. But if we left untreated or incomplete treatment can cause grievous complication. As a doctor, you know, the surrogate is going to ask me, doctor, I want to go home. You already know that from the scenario. So you start in a very panicky way. In a panicky way, what I mean by that, you will bring the, impending danger and complication in your voice if they left early or they did not complete the treatment. This is how you will, revert their, impending thought. So how I can do that? So the infection is very grievous, which is very important to treat the conditions in the hospital setting by giving an antibiotic medication through the blood channel. Then give some pause and let them absorb. And at this point, Dr. Hassan, you said IV channel. IV is a jargon. I would say blood channels, okay, through the blood channels of your, hands. So then they will say, doctor, is it really necessary? Or is it really, do I need that? Because I'm feeling completely fine. Why I need this? So as a patient point of view, it's completely fine. And he completed 2 days antibiotic and he's feeling completely fine. But you have to explain, it means the bug medication is responding and it kill almost most of the bacteria, but there is some still bacteria is there. Bug is in the blood and we have to clean up it completely. That's why it is very important to stay in the hospital, complete all doses of medication under someone's supervision. And by the way, this is the first reason. Second reason, we have to measure the drug level before giving another medication. We have to monitor some, blood test and also, see your progress by doing some blood test. And this is very important. Yes, I can understand you have some worries about your family. May I know, Mr. Harris, why you want to go home apart from this? Okay, we'll manage your family by involving the social workers. Is there anything else that pulling towards the home? So in a case of Dharma, let me take another slide. In a case of, refusal to stay in the hospital, in a case of refusal to stay in the hospital, always look for some A. A means they are trying to avoid something in the hospital. It can be in the hospital. They're trying to avoid something in the hospital. Or it can be something attracting to the home. Attracting to the home. Attracting means probably they want to escape the rigid regime or hospital boringness. They want to be to watch some YouTube or want to join in the birthday celebration or something urgent. Probably they are not able to do smoking. They want to do that in the home. There are lots of causes could be there that actually pulling them towards the home. So there are 2 causes. There is something they're trying to avoid. It can be bad test, boring environment, or they want to avoid the long medication. There are lots of causes could be. There's something they want to avoid. Okay, so probably the bed is not clean. I'm not getting enough sleep. Okay, due to some noisy environment. They are trying to avoid this. Okay, although they are well informed about their complication, or there is something they want to do in the home. It can be someone's birthday celebration. Concern about their family member. These are the things that are attracting them. And another thing is probably unawareness, lack of awareness. This is another A. They are not aware. They are not aware about the complication. So what you can say, okay, Mr. Harris, I can see, and you're feeling fine. That's really fine. And you want to go home. Do you have any idea? This is the reverse psychology. How? If you explain from the doctor's point of view that this can happen, blah, 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 believe me, they don't care because they always focus on the present state. I'm feeling completely fine. So why I have to stay in the hospital? But if you ask in a very reverse way, okay, Mr. Hassan or Harris, I understand that you are feeling boring or you're feeling completely fine. Do you have any idea what might happen if we did not don't complete the treatment properly or left untreated? What will happen? Then patient will say something or they are completely vacant. And this is the area where you can use your weapon. What I mean by that, they will probably say, doctor, there will something happen. It's a normal infection. Probably I have to come to the hospital once again. Based on their knowledge, you can seal it up. Okay. So you can, in this case, you can be very vigorous. What I mean by that, you have to say every possible complication in a very vigorous tone. What I mean by that, okay, Mr. Hassan or Harris, if you don't complete the treatment, the infection will be spread again. You will fever the same symptoms in a very vigorous way. I'm afraid to say that the heart may fail, the infection may spread and can spread to the brain. We call brain abscess. Do you have any idea? Okay. So, and the second time infection become very resistant, which means very difficult to treat with this antibiotic medication. So that's why the first chance is a very good chance and we have to complete the treatment. So are you following me? Then Mr. Peter Harris will be, okay, oh my God, I did not thought in that way. It can happen, okay. So doctor, what about my family member? Because I'm very concerned about that. So arrange that part. If they still push, okay, then I want to go home. Then involve the consultant. Involve the consultant in a way not to arrange the DAMA process. Rather, create some gap. Okay, I'm going to talk with my senior, have a short meeting. Okay, just after this, probably he will be in better position. He will explain and you will understand that. If they say, no, doctor, I want to go home, I don't care about your consultant meeting or consultant, then you can inform, okay, fine. In that case, we'll have to involve the bug specialist or microbiologist. Then we can arrange the DAMA process, discharge again medical advice. But in that case, the risk is yours. Okay, but we'll suggest you to come to the hospital immediately. So what will happen, Dr. Hassan, I'm asking to you, if you allow the patients to go to home, what advice you want to give? What are the way of giving the remaining dose of medication? Dr. Hassan, are with me?
Yes. After consulting the infectious disease, okay, I will tell him if you feel a fever again, heart racing, short of breath, you must come to hospital immediately.
Yeah.
Okay.
Safety netting. Yes, continue, please.
I will. Yes. If you this signing of DAMA will not affect it to come back again.
Come back again. We'll continue the rest of the treatment you are trying to say, but just hold on. Okay, fine. So, in a case of, when patient is planning to go to, discharge from the hospital, there are a few other steps we can perform. Okay, as I said, doctor, we can involve the consultant, we can involve the community nurse, district nurse. We can also involve the microbiologist. Okay, yes, they can go home with their own risks, but they have to continue the antibiotic medication in the community district hospital, where they have to come every day and they have to take the medication through the blood channel twice daily. So it's really troublesome process for them, but only good advice we can give them. They have to complete it, okay, if they want to go home, and give the reassurance that when they will come back, would not be judgmental, will continue the rest of the treatment, but there is a chance of treatment failure. The risks might happen. They have to be responsible for their complications. So these are the important things we need to address. Now, coming to the few other points, okay. As patient has infections, we don't know from this scenario what are the source of infection, okay. So we don't know. But as I said, Dr. If you ask, sometimes we did notice when someone, took some bloods from other people, blood transfusion, do needling, tattooing, share the needles. Sometimes they may encounter this type of infection. I don't know, Mr. Peter Harris, is there anything happen in your case? This is a non-judgmental approach you can use, okay, to find out the underlying cause. If they say, don't know, doctor, I don't know. Okay, so just stop there. But always, give some safety net, okay? As you are going to the home, try to stick to the medication. Feel free to come to the hospital. If you have any chest pain or any other features you are feeling, come to the hospital. We'll be, happy to continue the treatment. But I'm going to write you a note. If they are really going as in the format of the DAMA, which is again medical advice, still you have another duty as a safe doctor. I'm going to write the community hospital nurse, okay, about the treatment and the next plan for you. Okay, are you happy with that? Yes, doctor, I'm happy with that. So still there is a scope in the NASS. If the patient is really busy, have some issues their home, the patient is hemodynamically stable, not in a way patient is unstable, in that case you can discharge them with a proper advice and plan, with a written plan to their community district nurse hospitals, okay, so that they can continue the rest of the treatment. But always give the reassurance, okay, if you feel free, or if your problems is just end up the problem becomes severe, chest pain and shortness of the breath, feel free to come to the hospital. We'll happy to continue the treatment, okay? So this is the advice you can give to the patient. So the in short line, I would say involve always intermediate, okay? Always use the way to make the adherence, and don't leave the patients that, okay, fine, they're not following my advice, I will give the DAMA. No, before giving the DAMA, there are lots of things you can do. You can explain the complication in a very grievous way, the first job. Still you fail, try to arrange a quick session or meeting with their consultant. Probably the consultant will be in better position. Then you can go home, give the reaction. Don't force them, because where there is a force, there is no way they will stay. There is no willpower, okay? So they will reverse your plan. So just say, okay, fine, you can go home. Can you just give us few minutes or few moments, like we can have a quick session with our meeting with our consultant. Probably they will be in better position to explain you. No, doctor, I would not go to I would not listen you, I would like to go home. Then involve the microbiologist, okay, bug specialist. And when every step is failed, take the DAMA sign as you're going. It's also when you are taking sign, patient is feeling, okay, I'm giving the sign, taking the full responsibilities of my risks. Is it worthwhile? Still at this point, they can reverse their plan. And lastly, involve, okay, fine, as you made your mind, you want to go home, I'm informing and writing about your treatment plans to the community nurse, district nurse. They will continue the rest of the treatment, okay? And feel free, if you have any issues in the form of chest pain, fever, feel free to come to the hospital. We'll be non-judgmental, we'll continue the treatment. Dr. Hassan, are you with me?
Yes, doctor. Yes.
Okay, so the case is simple. The case is very common and coming frequently, but the step always we should follow. In bottom line, if I say, always explore 3A, about their awareness of the disease, how much they know about the impending complication, anything they're trying to avoid. Second A, in the hospital, okay, anything attracting them in the home. It can be family, it can be friends, it can be any TV show or urgent meeting, or it can be paid. Okay, anything can be in the home that attracting them. So attracting, avoiding, and probably they are completely unaware about their disease. So follow this protocol and follow this also plan. When patient is really, really serious, to go to the home, mention the complication in a very grievous way. If the first step fail, involve the consultant, request for a short meeting. If they still no, I want to go home, involve the microbiologist to formulate a better management plan so that the district nurse can continue. Okay, take the demo sign and involve the community district nurse to continue the rest of the treatment. This is how we can complete the scenario. If anyone has any questions, you can ask now. Vitals, home parent, yes. Dr. Sabir mentioned home parental antibiotic. Home parental antibiotic, not. I would say community center, community district, community. Clinic. Parental antibiotic in the NASS. Okay. And yeah, IV medication can be given at home. Yes, there are options to continue the IV medication in the home, but we would not use it at the very first instance. This is the last resort. Okay, there are lots of options there, but there should be some setup, and family members should be well oriented with the IV medication, because every time the nurse will give, probably they will complete few doses, and rest of the things they have to complete. So there are lots of things, but I would say follow this step. Okay. No, the medication they should follow the protocol of the community center. Okay, community center. We should not prescribe the medication completely at home. And if I prescribe, probably the theme of the scenario, the retaining power as a doctor will be lost. An examiner definitely not looking from you. Examiner is looking what are the possible way you are trying to retain the patient by your word of communication. That's the whole purpose of the scenario. But if you just arrange the home treatment, the theme of the communication completely collapses. Okay, so that's why no, use the maximum effort to retain them in the hospital. Then I'm coming. There are a few NICE guidelines. What are the NICE guidelines saying? Okay, the NICE guideline is saying 4 to 6 week intravenous antibiotics should prescribe. Okay, at the same time, we have to monitor the other complications. Risks of early discharge, we have to explain in a very grievous way. As I said, recurrent infection, valve distractions, systemic embolism can happen. Home treatment, yes. Home treatment can give only stable patient while there is proper and appropriate support is there. As we don't know from the scenario, so we can and should blindly. We keep it at the last moment, okay? But we have to apply other step as well. Patient support. If the patient is saying the word is very dirty, the food is not tasty, or some behavior of the nurse is really unacceptable, in that case you have to involve the ward manager to bring some taste and flavor to correct the bad behavior of the staffs. These are the things you can do in the hospital setting. Yeah, when the hospital part is completely fine, there is something really attracting to the home, then arrange the community support and write something. So these are the usual way. Good afternoon, good morning, Mr. Harris. Okay, thank you for talking to or giving some time to talk to you. Okay, then you can start in this way. And patient will typically start with this. Okay, doctor, I feel fine, and I don't understand why I have to stay in the hospital. This is the very well-educated, very well-calibrated patient scenario. But sometimes patient will not start in that way, doctor. I came to the hospital, they did some medication, but I don't know actually what's going on. They may start in that way. So in that case, you have to start from the very beginning. So it depends upon the surrogates, competency and how they calibrate and recall the scenario. Sometimes patient will say, why I need to stay in the hospital? Just treat this infection as a simple infection. So you have to explain why it is serious. It's not a lung or infection in the water tract or urinary tract. Is something really dangerous as the heart is concerned. Okay, so explain, bring some severity and tone, something in your tone that will actually help them to understand is how much severe this disease is. Okay, if left untreated. Okay, if I feel fine, isn't that a sign that the infection is gone? No. When we give the antibiotic. Okay, it means that antibiotic is responding, but to wash out, to completely clear up the infection, it usually takes complete dose. Although you are feeling fine, but if we stop the medication, the infection will be multiply and back. And in that situation, it can be worse. Okay, what will happen if I left early? It means surrogate is asking to you to check your, knowledge of complication, and in that case, use the maximum, odds scenario like heart damage, heart failure. I mean, um, spread to the brain. Okay, may cause cerebral abscess. There are lots of things can happen. Can get a treatment at the home. This is a special situation. Yes, home treatment is as an option in NHS. You can, but it depends upon the severity and scenario. As the scenario, in the scenario, you have to make every possible effort to keep the patient in the hospital. I would say don't mention home environment because this is your task. Address his concern about staying in the hospital. Explore the way to make his stay more comfortable. It means if you just go on that part, home part, the theme of the scenario will be collapse. And they will say, okay, fine, doctor. As you said, I can go home and I can continue the rest of the treatment in the home. An examiner will notice, okay, you did not show the maximum effort to retain them. So any questions from anyone? Dr. Hassan, any questions from your side?
Okay, just I want to know. This must be 6 weeks IV antibiotics. Is that
4
how?
to 6 weeks, yes, 4 to 6 weeks.
Okay.
In the community, involved, Dr. Kenny, yes. Dr. Kenny, you raised your hand.
Good
No,
afternoon. From the NICE guidelines, the hospital support at home. I know at times they do have what they call is a hospital at home if they have the capacity to give the IV
Yes.
antibiotics.
You are
at home.
trying to say the home environment is also applicable, right?
Yeah, but I think we shouldn't go that way at all.
But
Only
in the
if
context of the scenario, would not, encourage the patients to
at all.
continue the rest of the treatment.
No, I think the best thing is to really convince the patient, as you said, you start with them, you be in control and start with that voice to say, you know what, it's dangerous. This is a very serious infection. If you don't treat it in the hospital, we need to be monitoring you. If you go home, we're not able to do all that monitoring. Can you remember every day we're checking your temperature, your blood pressure? All that points towards things. We look at all these things. But if you go home, we won't be able to do that. So you need to stay in hospital. But I think at the end of the day, if there is no way out, and you could always say, okay, we'll speak to the bug doctors to find out if there's any antibiotics that could be given through the day. Because I know they used to have, I don't know if they still have it, some hospitals do have nurses or a team that can give antibiotics. I think maximum they can give is till about 6 p.m. So if there's that kind of antibiotics, then they can give. That's if there is no way out, if the patient is not bulging. But I think this particular scenario is for us to make sure we convince the patient.
Yeah.
Thank you.
Yeah, I'm completely agree. Yes, home treatment is also available, but as a task point of view, explain, retain, more comfortable. That's why we have to put the maximum effort to retain in the hospital. Yeah. Okay, so thank you. It's a short session, but the case is very popular and very, very common in different center. I did not mention the name of the center because it came almost 10 or 12 center, okay, in a different way. But the core theme is almost same. Okay, you have to retain the try to retain the patient and try to give the maximum way and effort to retain. If they want, then arrange a session with the consultant, then involve the microbiologists and community district nurse. So in this type of scenario, try to show some empathy to understand their situation or frustration. Like it's really boring to stay in the hospital, right? 6 weeks is really boring. Clarity, always bring the clarity why it is important. The clarity, how we can bring that? By clearly mentioning why it is needed to continue the medication for 6 weeks, what will happen if we don't, and what are the complication he is going to develop if we did not complete the treatment. Okay, so give the reassurance, every type of support will be there, and yes, their comfort would not be hampered if they are missing their family member, we can bring them and we can give them support through the social worker. So there is no other way we cannot make them happy. So there are lots of possibilities. You just have to use the language, okay? Because every support is available in the NHS. Structure, I would say start with the baseline from why they're admitted in the hospital, what they're facing now, what's our team plan. Okay, always make it a habit. And that's why I always say when you are having given a sheet of paper, make it 4 quadrant. In the first quadrant, don't underestimate patient's role, your role, patient's name, patient age, because many candidates, give me the feedback, okay, after entering into the exam hall, they've completely forgot the patient name, although they assume it's very easy name I can recall, but in the exam pressure, you can easily forget their name, okay? So this is the quadrant for patient name, your role. This is the second box, very important box. You can just, write, okay, patient has some problem. Now we did some investigation, blah, blah, blah. And this is how you can make by arrow. Okay, once you will, put your eye on this paper, everything will be pop up, the whole scenario, okay? Just make it short. In the third box, left bottom, I remember in my way, VT, visible tasks. What are the tasks I have to do? I have to keep the patient retained in the hospital. I have to make every possible effort to make them agree to stay in the hospital. This is a visible task. What are the non-visible tasks? Smoking, alcohol, impact, okay, about the family member. These are the things is non-visible tasks. So visible task, NVT, non-visible tasks. These are the 4 quadrant. Never miss it. Make it a habit in your practice. Hopefully, it will be incorporated in your brain once you will be, going to happen in the exam. So thank you for joining, Dr. Hassan. Thank you.
What did you call it? NVT?
Okay. So it's actually my way. It's not a strict regime. I use in that way. This is a sheet of paper. Usually, you'll be given in the exam, right? And I usually make 4 quadrant to make it very easy. Okay, in the first part, patient's name, role, patient's relative's name or role. In the second part, make a short note. Okay, patient presented with chest pain. Then we did echo and we find that team plan is that, just in a short way. In the bottom part, this is visible task. Visible task mean what is written in the scenario, what I can see. I have to make the patients to stay in the hospital so that they can stay in the hospital, complete the treatment. This is the visible task, but non-visible, what's not written in the scenario, but as a default, we have to cover in every scenario. What I mean by that, their social history, smoking alcohol, with whom they are living, how much it is impacting their daily life. In based on the scenario, it can be driving, it can be their hobby, like high track or scuba diving, mountain climbing, or fireworks. It depends upon the scenario type. If the scenario is epilepsy, in that case, you have to go for that. Okay, if the vision problem or affecting the driving, you have to ask the driving, do you drive? So these are the non-visible, but almost you have to touch in every scenario. So these are the 4 quadrant rule.
No, so Mamoon, somebody gave us a very lovely mnemonic the other day, which is Sajid. Sajid, which is S is for social.
No, Sajid, yeah, Sajid is we use in LP. We use in the probably in the LCC more in the Sajid. Social, alcohol, job, impact, driving. Yeah.
Thank you.
Thank you. Fine. Thank you for joining. Thank you, everyone. If you have any questions regarding the scenario, you can ask me. If not, then we'd like to conclude the session for today. Fine. Thank you. See you soon on the next session. Probably tomorrow we'll have a mega session. I'm planning to that. I will give the announcement very soon in the group. Thank you.